Discover Casgevy, hexagamglagene autotemcel, a first-of-its-kind CRISPR-Cas9 modified cellular gene therapy. Indication: Casgevy is indicated for the treatment of patients aged 12 years and older with sickle cell disease, SCD, with recurrent vaso-occlusive crises, VOCs, transfusion-dependent beta thalassemia, TDT. Important safety information, warnings and precautions. Neutrophil engraftment failure. There is potential risk of neutrophil engraftment failure after treatment with Casgevy. In the clinical trials, all treated patients achieved neutrophil engraftment and no patients received rescue CD34 positive cells. Monitor absolute neutrophil counts, ANC, and manage infections according to standard guidelines and medical judgment. In the event of neutrophil engraftment failure, patients should be infused with rescue CD34 positive cells. Please see the important safety information at the end of this video and full prescribing information at casgevyhcp.com. Soon after birth, the production of fetal hemoglobin shifts to adult hemoglobin. This shift is mediated by increased BCL11A expression. Patients with SCD or TDT have a mutation in the beta-globin gene, and the onset of disease symptoms typically coincides with the shift from fetal hemoglobin to adult hemoglobin. In SCD, under the conditions of deoxygenation, this mutation results in sickle hemoglobin polymerization, deforming red blood cells into a sickled shape, impairing blood flow and leading to vaso-occlusive crises and associated complications. In TDT, the mutation leads to an absence or reduction of beta-globin and a subsequent increase in unbound alpha-globin, ultimately reducing the number and function of red blood cells, leading to anemia and the need for regular transfusions. Patients with co-inheritance of SCD or beta thalassemia and a condition called hereditary persistence of fetal hemoglobin, HPFH, continue to express high concentrations of fetal hemoglobin into adulthood and experience a milder clinical course. Casgevy was designed to mimic the phenotype of hereditary persistence of fetal hemoglobin, increasing levels of fetal hemoglobin with the potential to address the underlying cause of disease. Casgevy is manufactured ex vivo using a patient's own CD34-positive hematopoietic stem cells, or HSCs. The CD34-positive HSCs are edited using a CRISPR-Cas9 complex introduced non-virally via electroporation. A single guide RNA directs the Cas9 enzyme precisely to the erythroid-specific enhancer region of the BCL11A gene and disrupts it, reducing BCL11A expression. Due to this precise approach, effects of BCL11A editing are only intended to occur in the red blood cells. Once reintroduced into the patient's body via a one-time infusion, the edited cells are expected to engraft in the bone marrow and differentiate to erythroid lineage cells with reduced BCL11A expression, which results in increased gamma-globin expression and fetal hemoglobin production. Important safety information continued. Warnings and precautions continued. Delayed platelet engraftment. Delayed platelet engraftment has been observed with Casgevy treatment. There is an increased risk of bleeding until platelet engraftment is achieved. In the clinical trials, there was no association observed between incidence of bleeding events and time to platelet engraftment. Monitor patients for bleeding according to standard guidelines and medical judgment. Conduct frequent platelet counts until platelet engraftment and platelet recovery are achieved. Perform blood cell count determination and other appropriate testing whenever clinical symptoms suggestive of bleeding arise. Important safety information continued. Warnings and precautions continued. Hypersensitivity reactions. Hypersensitivity reactions, including anaphylaxis, can occur due to dimethyl sulfoxide, DMSO, or dextran 40 in the cryopreservative solution. Monitor patients for hypersensitivity reactions during and after infusion. Off-target genome editing risk. Although off-target genome editing was not observed in the edited CD34-positive cells evaluated from healthy donors and patients, the risk of unintended off-target editing in an individual's CD34-positive cells cannot be ruled out due to genetic variants. The clinical significance of potential off-target editing is unknown. In SCD, fetal hemoglobin expression can reduce intracellular sickle hemoglobin concentration, preventing the red blood cells from sickling and thus avoiding occlusions. In transfusion-dependent beta thalassemia, increased production of gamma globin may mitigate the alpha-non-alpha chain imbalance by pairing unpaired alpha globin with gamma globin, producing fetal hemoglobin. This results in increased total hemoglobin levels, reduced ineffective erythropoiesis and hemolysis, and ultimately improved survival of red blood cells. Casgevy is a first-of-its-kind CRISPR-Cas9 modified autologous CD34-positive cellular gene therapy. The CRISPR-Cas9 complex, delivered into the CD34-positive HSCs ex vivo using a non-viral approach, edits the DNA at a precise location to increase fetal hemoglobin production. Casgevy is a one-time infusion for patients who are 12 years of age or older with SED with recurrent VOCs or TDT. The treatment process includes mobilization and apheresis to collect CD34-positive HSCs, editing CD34-positive HSCs to manufacture Casgevy, myeloablative conditioning, Casgevy administration, and follow-up to monitor for engraftment and adverse events. Important safety information, warnings and precautions. Neutrophil engraftment failure. There is potential risk of neutrophil engraftment failure after treatment with Casgevy. In the clinical trials, all treated patients achieved neutrophil engraftment and no patients received rescue CD34-positive cells. Monitor absolute neutrophil counts, ANC, and manage infections according to standard guidelines and medical judgment. In the event of neutrophil engraftment failure, patients should be infused with rescue CD34-positive cells. Delayed platelet engraftment. Delayed platelet engraftment has been observed with Casgevy treatment. There is an increased risk of bleeding until platelet engraftment is achieved. In the clinical trials, there was no association observed between incidence of bleeding events and time to platelet engraftment. Monitor patients for bleeding according to standard guidelines and medical judgment. Conduct frequent platelet counts until platelet engraftment and platelet recovery are achieved. Perform blood cell count determination and other appropriate testing whenever clinical symptoms suggestive of bleeding arise. Hypersensitivity reactions. Hypersensitivity reactions, including anaphylaxis, can occur due to dimethyl sulfoxide, DMSO, or dextran 40 in the cryopreservative solution. Monitor patients for hypersensitivity reactions during and after infusion. Off-target genome editing risk. Although off-target genome editing was not observed in the edited CD34-positive cells evaluated from healthy donors and patients, the risk of unintended off-target editing in an individual's CD34-positive cells cannot be ruled out due to genetic variants. The clinical significance of potential off-target editing is unknown. Adverse reactions. The most common grade 3 or 4 non-laboratory adverse reactions, occurring in greater than or equal to 25%, were mucositis and febrile neutropenia in patients with SED and patients with TDT, and decreased appetite in patients with SCD. All 100% of the patients with TDT and SCD experienced grade 3 or 4 neutropenia and thrombocytopenia. Other common grade 3 or 4 laboratory abnormalities greater than or equal to 50% include leukopenia, anemia, and lymphopenia. Drug interactions. No formal drug interaction studies have been performed. Casgevy is not expected to interact with the hepatic cytochrome P450 family of enzymes or drug transporters. Use of granulocyte colony stimulating factor, GCSF. GCSF must not be used for CD34-positive HSC mobilization of patients with SCD. Use of hydroxyurea. Discontinue the use of hydroxyurea at least 8 weeks prior to start of each mobilization cycle and conditioning. There is no experience of the use of hydroxyurea after Casgevy infusion. Use of voxelotor and crizanlizumab. Discontinue the use of voxelotor and crizanlizumab at least 8 weeks prior to start of mobilization and conditioning, as their interaction potential with mobilization and myeloablative conditioning agents is not known. Use of iron chelators. Discontinue the use of iron chelators at least 7 days prior to initiation of myeloablative conditioning, due to potential interaction with the conditioning agent. Some iron chelators are myelosuppressive. If iron chelation is required, avoid the use of non-myelosuppressive iron chelators for at least 3 months and use of myelosuppressive iron chelators for at least 6 months after Casgevy infusion. Phlebotomy can be used instead of iron chelation when appropriate. Use in specific populations. Pregnancy, lactation. Casgevy must not be administered during pregnancy, and breastfeeding should be discontinued during conditioning because of the risks associated with myeloablative conditioning. Pregnancy and breastfeeding after Casgevy infusion should be discussed with the treating physician. Females and males of reproductive potential. A negative serum pregnancy test must be confirmed prior to the start of each mobilization cycle and reconfirmed prior to myeloablative conditioning. Women of childbearing potential and men capable of fathering a child should use effective methods of contraception from start of mobilization through at least 6 months after administration of Casgevy. Advise patients of the risks associated with conditioning agents. Infertility has been observed with myeloablative conditioning. Therefore, advise patients of fertility preservation options before treatment if appropriate. Please see full prescribing information for Casgevy at casgevyhcp.com.